welcome to the Inside Connection podcast, powered by MediConnect Insurance. I am Sean Horn. She is my great friend Lauren Yuran, and also welcome to the Medicare annual enrollment period, October 1st. How you feeling?
That time of year is here yet again, and I believe, again, if I counted properly, this will be my 13th annual enrollment period in the business.
Same here.
And it's one of those things where we get very excited. I'm sure the audience listening might not be as excited to get bombarded by mail and phone calls, right? But we're excited. We know what competition's coming out there. We know what benefits are changing, and we're ready to get going. You know, you have to get yourself pumped up and excited because we have 67 days to make this all happen, to help as many people as we possibly can. So yeah, let's get rolling.
So yeah, let's get to work, right? And really what we want to focus on in the first segment is, you know, we got to dispel the notion that if it isn't broke, don't need to fix it, right? And we, as we get older, we hate change because it can be complicated at times and whatnot. And, you know, really what I want to talk to the audience about today, again, as we start this episode is, why should we get off the sidelines this year? Now, we're going to spend a lot of time talking about the benefits in the second segment, so you may want to pay attention to what some of the carriers are going to be offering this year. But as a consumer mind base, right, we get on a plan, we're comfortable with it. Hopefully, we didn't have to use it too much this year. And if that's the case, okay, I got this paper saying I'm all good, I'm just going to let it go. What kind of damage could we be doing to ourselves by just taking the path of least resistance?
There's a lot of damage that can be done. And I think that for me, when I have a consumer that's coming onto Medicare, especially for the first time, and choosing an Advantage plan to start, which again, in our area, about 70% of the population is choosing those Advantage plans. Whenever I'm putting somebody onto one of those for the first time, I say, don't get comfortable. And I kind of try to compare it to shopping. It's like every year you have the shopping season kind of before Black Friday, if you get it out of the way before that December 7th date, right? You can explore your options out there. And maybe something that was important to you last year or a couple years ago, if you haven't reviewed your plan, is important to you. Maybe even something is new on benefits that wasn't even offered in years past. I remember, talking to a colleague not that long ago about when we first entered into the business 13 years ago, and the benefits that are out there now compared to the benefits that were on those plans at the time. And just, I never would have imagined the benefits be so robust now. So, there might be something you weren't even looking for, didn't even know that was, offered on these plans that could be new or could be out there on a plan that you could take advantage of. Case in point, I had a lady last year that I was working with, and she didn't, need a plan with dental. She had just retired, got all of her dental done, and she was on a plan, but, I explained the 5 stars, and she called me mid-year and said, oh, I need a root canal. I need some dental coverage now. And we were able to do that for her, which was really wonderful. But, your needs change throughout time, and the benefits that are important to you change throughout time. Maybe you're traveling more, maybe you're traveling less, and, your plan can assist you along the way with all those things.
Yeah, so your needs may change like the weather, especially here in Pittsburgh. So we really got to make sure that, as your needs progress or at least alter, we need to make sure that your plan is acting accordingly. And, we just came out of the part of the year. Now the annual notice of change has been delivered to the consumer, so they get a look at how their plan compared versus last year, what changes are going to happen, what costs are going up, or what have you. So we've been through all that. But now the consumer is calling their agent that they worked with last year saying, what do I need to do? Do I need to change or anything? And generally speaking, when working with MediConnect at least, we're always going to recommend, let's sit down, let's get together, let's take an assessment of your situation now and compare it against what is available in the market this upcoming year. Why is taking a path of least resistance, again, calling that insurance agent that you worked with last year saying, am I good? And they just go, yeah, you're fine. Why can that hurt our viewers today?
So, again, that does happen frequently in this industry. Agents getting a residual, they say, hey, your plan's staying pretty competitive.
What's a residual? What's a residual?
A residual is an amount of money they're getting paid from a commission standpoint to basically have you as a client. So they make money off of your enrollment as long as you're enrolled onto the plan. And again, they're standardized, so it doesn't matter what carrier really specifically that you're with, but that their duty is to you and to making sure that your plan is still fitting your needs. And again, if they say, hey, you're good, and they're moving on to the next client, to get a new client to build that book of business, truly, that can be also harmful to folks, and they're not comparing. And when you're not comparing what's out there, you might be missing a benefit that's out there for you. What if you've had new prescriptions? And this is when I'm getting a lot. Actually, I got an email first thing this morning. Client had some new medications prescribed, and they're rather expensive. They're falling into the donut hole. Hey, can we take a look, October 1st when the new plans come out? Absolutely. We're going to look and see if there's a more competitive advantage on another plan out there. And the other thing is, in this market specifically, there's over 70 Medicare Advantage options. So, odds are there is something else out there that could really fit your needs. And these plans all change year to year, but there's so many options as well. And to call into the carriers for all 70 plans, or to, even try to do the research on your own, that's going to be a tough task to tackle. And that's where, again, if you sit down, we have a review, we can compare. And when we know what you need, again, traveling less, traveling more, PPO versus HMO. HMO plans, sometimes we see have a little bit more robust in the way of those extra benefits, because they're not allowing you to exit the network, whereas a PPO might have a little bit less in the way of those extras, but you have full network access, national network access, and access to out-of-network doctors. And it's really truly, what do you need? Do you need to see a specialist at the Cleveland Clinic, or do you need, a 700 plus flex card for dental work for a dentist that's not par? That's what it comes down to.
So there's a lot of industry jargon that we use in that little breakdown, but all of it is very relevant. But again, going back to the residual, I want to really focus on that for a minute, because when you make that phone call and the insurance agent says as much, they're guaranteed that payment come January, that, hey, you kept them on the books, you didn't have to do very much to service them, congrats, thank you for your service. And because as a consumer, you're used to not having to change, or you're not really liking change all that much, don't want to do the comparison. I almost feel like sometimes the consumer doesn't want to know what's accessible to them. Like, they don't want to know what they're missing out on, but yet they don't want to take the leap of faith of getting knowledgeable on it, because just how overwhelming all of this is. Where here at MediConnect with Medicare Made Simple, really an adage that we're living by daily, really you shouldn't have any real reservations about getting engaged into making sure that you can thrive with your healthcare moving forward. Is that fair?
That's absolutely fair. And you mentioned also too, Sean, the ANOCs came out, right? So ANOC being the annual notice of change. And let's say your plan stayed pretty stable year over year, or maybe even there's some increases in benefits and you're like, oh, this is exciting. I got more dental coverage. But what you don't know is the plans that you're not on. And there's a plan out there that has double that dental coverage that you maybe really need.
That's a great point. And by comparing, and again, we have the tools available to us. Thankfully, we have the state-of-the-art database where we could pull all the plan information from very quickly. Mm-hmm. And usually we're able to help people out within 30 minutes to be able to tell them, are they on the right plan for their needs, or should they really consider other options? And really, at MediConnect, again, Medicare Made Simple, really cannot stress that enough, because when it feels overwhelming to you, I mean, look, most people, they take their financial forms, drop it off at their accountant, and say, do your work, right? We don't go in there asking, hey, did you apply for this tax credit, or am I good for this? We just go, do the paperwork, I'm done, and move on, right?
Another comparison, too, is mechanic, right? I'm not going in there telling them how to fix my car. My car's in the mechanic right now, getting all geared up for annual enrollment period, so I can be all over the place.
But that's a great comparison, though, because, look, you're not underneath the hood trying to fix it and everything like that. You're just trusting them that, look, you're going to get me back on the road. Well, by not looking at your Medicare options available to you, especially with the competition that's available now, you talked about the 70 plans that we have to look at and really whittle down and make sense for. When you have that type of competition, and some of these carriers, again, we're going to talk about in the next segment, some of these benefits are going to be made available. Some of these carriers are really pushing the envelope this year. So when that happens, there's a market shift that takes place. If the other competing carriers aren't taking notice and adjusting appropriately, they're going to lose market share. So really, when you have one that pushes the market, the rest of them follow.
And here specifically in Western Pennsylvania, Allegheny County is the second oldest population in the nation. 1 out of 5 residents in Allegheny County is over the age of 65.
That's unreal.
And the carriers know this. They look up all this data. That's why they're all here. That's why there's over 70 plans available to us. This competition is fierce. It is real. And you could be missing out extremely if you're not taking a look at those benefits and not doing a checkup to see what's out there and available to you.
So, and I want to bring it back to this one last point. And again, I'm getting off the residual thing now, but I do want to make it my own parents have been on Medicare now for 5 years.
Okay.
Every single year they've been on a different plan.
Yeah.
And I'm in this industry, know it pretty well, and I have moved them every single year based off of their needs. My mom takes a couple medications that kind of throws things off from one year to the next. As a result, we really got to pay attention to what's on her formulary so that she's paying as little as possible.
And that is a huge point because, again, you can get the mailers and the phone calls and you see all these snazzy benefits too. But what you might not see behind the scenes is a medication goes up in a formulary to a higher tier, and now you're paying a lot more out of pocket for that medication. So where a plan might be fitting you well in the side of some of the extra benefits, it may no longer be fitting you well moving forward with your medications. And there's 70 other options plus out there to see one that's going to fit your medications more in line with where you need to be and still have additional benefits.
Yeah, so I guess more than anything, really, 888-818-6334. Call right now, get your appointment set. No cost, no obligation, just great information is all we promise to deliver to you. But really what we're trying to help you protect against is that sticker shock in January when you go to the pharmacy and, hey, that wasn't what I paid last year. Well, you didn't compare. Now get that comparison in. Make sure you thrive with your health care. It is possible, folks. You could be spending a lot less money per year. And look, before we go, you have paid for Medicare all your working life. You're continuing to pay for Medicare here in retirement. Why on earth would you want to spend $1 more than you need to for your Medicare coverage? Call right now, 888-818-6334. Talk to a top-rated advisor. Get yourself scheduled. Get yourself handled.
Medicare is confusing and a little scary.
Plan B, Part B,
HMO, PPO. I feel lost.
Whether you're just starting Medicare or currently on Medicare, you're faced with critical decisions each year. Questions like, do I need a Medicare plan? Is my current coverage still my best option? Will I still be able to see my doctors? I'm Brian Breisinger with MediConnect, the area's premier independent healthcare advisory firm. We can help avoid costly pitfalls today and in the future. We can meet with you in person or over the phone. Choose an expert in your community.
MediConnect walked us through everything.
Best of all, it didn't cost us anything.
That's right. Our licensed experts can offer unbiased advice on all of your healthcare options at no cost to you.
MediConnect is a great organization.
MediConnect, bridging the healthcare gap. For no-cost advice, call 888-818-MEDI or go to MediConnectInsurance.com.
And welcome back to the Inside Connection podcast powered by MediConnect Insurance. And welcome to the annual enrollment period for Medicare. 67 days to determine if your plan is the best fit for your needs. And before we get into talking about plan-specific information, I do want to alert the audience that whichever side of the table you're on, whether you're on Medicare Advantage, Medicare Supplement, you have a lot of different options you can partake in and really assess over the next few weeks here. And if you're on a Medicare Advantage plan, you can go back to original Medicare, get a Medigap policy in a drug plan. You can compare your coverage between a Medicare Advantage and one of those 70 that are available. If you're on a Medigap, you might be able to switch your Medigap plan if you pass underwriting. So whichever side of the table you're on, Medicare Advantage, Medicare Supplement, we still strongly advise you call, because even if you have a Medigap, which remains pretty constant year after year, your drug coverage with your separate prescription drug plan, you're probably paying too much if you've been on that same plan for a number of years. So again, 888-818-6334, make sure you are not paying more than you need to. But as I teased before we head into the break, we got to talk about some of these benefits that are becoming available for our viewers today. And as we talked about in the beginning segment, this is a big year. Again, you don't want to be on the sidelines, because what some of these plans are doing, they're, again, pushing that envelope, making competition really meet the consumers where they are as opposed to the other way around. So if you're Medicare eligible, really pay attention now, because we're going to start off talking about UPMC.
Yes.
And what they have to bring forward for 2024. So we know that they have the concierge service, which top-notch, top echelon of really customer service in any industry in the way they handle their member services. But there's also some pretty amazing benefits they're bringing with them as well.
So again, can't say enough about that customer service, because truly, we see it day in and day out, where some other times we might have to three-way call with our members into some companies, not naming any names, but the UPMC customer service seems to always take care of the client's needs, and that is always, phenomenal for us. But yes, they're going to have a new PPO plan, Allegheny County specific, that is going to really be a wonderful option to take a look at. PPO, in and out of network access, flex card, all their Advantage plans have a flex card option on them. And what I like about the UPMC flex cards is you can use them, dental, vision, hearing, over the counter towards allotments. However, I've seen people who have a dentist that doesn't really accept insurance. I see this all the time. Dental insurance is a little bit different. And those flex cards can oftentimes be used at non-par providers to help cover cleanings that you're having, extractions, anything that you're seeing at a non-network dentist. So again, why not get that flex card and have that allowance to utilize towards those extras?
And I saw some of the numbers. I mean, they're like $750 on the year in flex card spending to use towards copays or what have you.
And you can use them towards copays. You can use them towards dental, vision, hearing. You can use them towards over-the-counter products if you would like. So there's a wide array of different services that you can utilize them for, which again kind of boils down to the fact that who can't use $750 towards something medical, whether it be band-aids or a surgery or dental. Really, $750 in your pocket.
And the plan we're referring to has a $19 a month premium.
$19 a month.
Yeah, I mean, and again, we're seeing more and more plans come closer to zero as opposed to the other way around. So especially if you're paying attention this morning and you're on a Medicare plan where you're paying more than even $50 a month, you really need to make that phone call to MediConnect today, because again, some of these plans are just unreal. The next one we're going to talk about is Highmark.
So copays as low as $0 for specialists.
Wow.
$0 for PCP, which oftentimes we see $0 primary care provider copays. That's pretty commonplace now on Advantage plans. But the $0 for a specialist can really save somebody. And I know I have a, kind of family member that had to have multiple physical therapy, occupational therapy, and moving on to a plan, within the Highmark realm, that have these low or no copays for the specialist. If they're seeing that service 3 times a week for 6 weeks after a fall, you're saving a fortune. Yep. It's built into the benefits where you're going to have lower copays. And, again, $5 for physical therapy, and these plans also hitting that price point, less than $30 a month, or they do have a plan that's, kind of nearing that $50 range. And that plan is going to have a lower maximum out of pocket, which is the spend that you have throughout the year medically, as well as those $0 copays for specialists and first dollar dental coverage.
That's a big deal. So, but it's also worth noting as well that Highmark also ties you into the National Blue Cross Blue Shield network. So,
powerful name, recognized throughout the nation.
Yeah, so that's another one. If you do any sort of traveling, or you're not a traveler yet, you want to see out of network or out of region specialists because you have a situation. Very easy to do with Highmark now. And again, with the way they keep their copay structure same in or out of network, that's pretty awesome work they've done. One of the industry leaders here locally, Aetna, pretty expansive network, also strong in benefits. What do they have going on for 2024?
So you mentioned, perhaps the largest of the local networks that we see, but they're a national carrier. So you can hook in even on an HMO plan that doesn't allow out-of-network access. You can hook into their national network. So if you are traveling, you can travel with an HMO, which is very strong. And that allows you to go to places even such as Cleveland Clinic, right? That's right over the border for us. Some people like to go see a second or third opinion there. And, stable throughout the years, lowest or longest standing $0 premium plan in the marketplace. And
yeah, they drove that market, really.
Drove the $0 premium market, and now adding vision onto that plan this year, which has been an ask for a couple of years, and we're really excited about that. Some competitive advantages in the dental realm as well. First dollar dental coverage. So we're seeing this, whereas historically you have a 50-50 copay with dental. So you have dental embedded onto a plan, but you're still on the hook for half the bill. They are taking care of that, where you get this allowance and it's first dollar coverage. So again, you can go get that dental work done and not have to split the bill with the carrier.
That's a big deal. One of the biggest names in insurance nationally is starting to make a lot of headwinds here locally. Cigna. We know about the $20,000 dental benefit. I mean, that kind of blew the market wide open last year when they announced that, and we all kind of went, are you sure? So for them to continue that on again in 2024, pretty big deal. But they also have some other pretty interesting things going for them this year.
So to pack a punch and to show the stability of a benefit such as $20,000 in dental coverage and bring that over year to year, again, very strong point to be had for Cigna. Also, prescription drugs, their formulary, we see that be extremely competitive, where some medications are just tiered lower. So some of the folks that we talked about in the first segment where you haven't maybe reviewed your medication coverage and maybe something's moved up to a more expensive tier or range, Cigna has a lot of very competitive formularies embedded onto their plans. And one thing with Cigna is they've now added the Allegheny Health Network into their network. So very excited to show that plan and talk about that plan with consumers because, locally speaking, they were brand new last year. Definitely something to keep your eye on and take a look at.
And we're seeing as well low maximum out of pockets, really strong benefits from a copay structure inside of these plans as well. So they've done a really good job making it competitive at the same time. And then I want to talk about Humana. Again, a national carrier. We see their 30-minute infomercials all over TV this time of year. They do a great job with brand awareness and talking about some of the things that have going on. But they're also, bringing a little bit of heat this year as well. And again, this competition is great for the consumer. So what does Humana have going on?
So they have a few different things going on. Their MA plans, so we work with plans that are MA only without prescription drug coverage.
So they're Medicare Advantage and they don't have prescription drugs. Okay.
Correct. And these are geared towards either veterans who are utilizing the VA
Okay.
or folks that are eligible for PACE or PACENet here in the state of Pennsylvania, which is prescription assistance. And with those types of coverage, you have your drug coverage either from the VA or from the state, and you're getting a Part B give back on these plans. So they're having Part B give backs as high as $100. So, if you're paying that Part B premium, you can get $100 back in your pocket with signing up for plans like this. We hear them talked about on the radio and on the television sometimes, right? That these plans do have the Part B give backs, very competitive for our veterans. And they came out with a private fee-for-service Advantage plan, which is a little different. There has not been one in the market, at least during my career. And this plan specifically is a really nice option for those that are on a Medigap. It's going to be a little bit higher premium, the $75 range, but it's going to have a lower maximum out of pocket of $1,500.
Wow.
And this plan, again, might be good for those who maybe are in need of a Medigap but can't pass that medical underwriting, or if their Medigap premium has gone up too high, might be a nice, way to compensate the coverage. And also, this plan specifically does have to be negotiated with your doctor. So there's a little bit there that, we need to make sure that your providers are in network and providers are willing to take. But this plan, very different than anything we've seen in the market and can really, really help those folks out that either A, need a Medigap and can't get it, or B, need the Medigap, maybe paying too high on the Medigap. This is really something you're going to want to take a look at.
So just to rehash, real quick review here. So we're talking Part B givebacks. We're talking up to $20,000 in dental. There's also $750 flex card spends that you can use on in and out of network. Copay levels are really, really low. You can travel a lot more freely with Medicare Advantage plans now. So this to me sounds a lot different of a Medicare market than it was even 5 years ago.
And, one thing I will throw in here that I forgot to mention in our first care that we talked about, UPMC, they have a plan that is an MA only plan that works well with TRICARE. So veterans that have TRICARE, and again, historically, TRICARE we kind of stayed away from because there was a lot of issues where bills would have to be resubmitted between the carrier and TRICARE. This plan kind of takes care of those inconsistencies and really speaks out there for those TRICARE consumers. So we have help to get you additional benefits for TRICARE as well. So like you were saying, different marketplace than 5 years ago, 2 years ago, right? For years, that TRICARE was kind of, you left that to the side. There was going to be some billing issues, but we have plans that are going to be very powerful in conjunction with that.
And in MediConnect, we work with all of the major carriers in this region, all 70 of the plans that are available in this market. We have the opportunity to compare them for you. There's never a cost, no obligation, just good information. And our process is very simple. We look at your puzzle, we put it together in front of you, show you a couple different options for you to consider, and it is for you to decide on the way that your healthcare works for you. We don't sell anything. We just advise on our knowledge to make sure that you are in the best position possible for your own needs on a yearly basis, year in, year out, never a fee. Medicare Made Simple, 888-818-6334, MediConnectInsurance.com. Call or click today. Get the help you need from the top-rated Medicare advisory firm.